Before everyone goes, though, a big shout out to those who helped make this happen. So, yes, yay. There's a lot of staff working on this behind the scenes. You've seen Jessica, but there's staff from the Wisconsin Council of the Blind and Visually Impaired, from our department, that have really worked together. I guess another example of the collaboration that we can see in the state of Wisconsin, so thank you to the staff. Ready for the questions?
Coming.
You were mentioning that you do research studies in that. Do you need more participants, and how would we go about that?
Thank you for your interest. At the Department of Ophthalmology booth, which is straight out the doors, there is a flyer that describes it, and you can sign your name there, and we'll call you back, or you can rip off one of the numbers to contact us and do that yourself.
I'll also add that in everyone's gift bag, there are 2 handouts from Julie's lab, and they include a cookbook and another flyer that has a lot of information, and also this, the websites that she mentioned.
Dr. Mayer, regarding eggs, does it make a difference whether the egg is runny or cooked firm?
We don't know, but a common sense answer is no. I think that your stomach doesn't know the difference.
I have a kind of silly question for diet, because my daughter, my oldest one, is very concerned about my eyes, and she did a little research, and she said that there's a Chinese recipe they've been using for a couple thousand years for AMD. She said they eat goji berries. What do you know about that?
I know that they're high in zeaxanthin.
In what?
In zeaxanthin. So
that good?
It's a compound like lutein. In fact, it's the same molecular formula as lutein that we've been talking about, and it actually concentrates in the center of the macula, and that's the section we need to see fine detail. So I think your daughter's giving you some good advice.
Well, thank you. I would just also like to say that the staff here, I hold you in high esteem. I know that I will pass away a diminished man because of a loss of sight, but my spirit will never be diminished because of a staff who is doing such great work for those future generations coming.
Which formula of PreserVision do you recommend? AREDS 2, there was a different one up on the screen.
The AREDS 2 formula is the one that's recommended by the American Academy of Ophthalmology, and that was the one tested in the trial. And these days, they're recommending only that contains lutein. However, I think you should talk with your doctor. Not all doctors recommend that specific formulation for their patients. They have sometimes reasons for adjusting the amounts. So I think that I know that some doctors in the community have recommendations for other types of supplements, and they may not have been tested in a clinical trial. That's the thing you have to wonder about. So you're really counting on your doctor's advice and knowledge of the science behind it.
I have a question for the gentleman. I am a Beckett's disease survivor, and I was blind when I was a child, and I was treated with steroids. And I have a lot of inflammation issues, and my mother has end-stage macular degeneration. I guess I want to know if there's anything special I should do because of the Beckett's and the inflammation things that I always have to worry about in terms of doing the things that are preventable for macular degeneration.
So how is your vision?
I've never had to wear glasses yet.
So you're doing fine. So the
I've
question
had
is,
my lenses replaced. I have multifocal lenses because I had cataracts early.
So the question is a good one, which is, what if I have other things, right? So, you know, I have AMD in my family, or maybe I even have AMD, but also I may have glaucoma, or I may have, in your case, you have an inflammatory condition that causes, you know, waves of inflammation, which can be painful and make your eye red and what have you. I mean, is there any connection between the two? And the answer to that is no. We don't know of any connection between the two. And does one make the other worse? Well, I think it kind of, a lot of this is going to be we don't know, right? But it makes sense to me, similar to the nutrition and the exercise and everything like that. If you think of macular degeneration, and this is an overly simplified way of looking at it, is that, you know, if we all lived to be 200, our parts would wear out, right? We'd all have dementia. We'd probably all have macular degeneration. We'd all have arthritis, right? Things wear out. Why do people's maculas wear out at age 55 when somebody else, you know, has perfectly fine vision to 110? That's really the idea. That's where genetics comes in and things like that. So, you know, it makes sense, though, in terms of what we can affect. Inflammation in the eye is not a good thing, right? I mean, you don't want to have inflammation in the eye, and glaucoma is another thing that can rob you of your peripheral vision and ultimately your central vision too. So it makes sense that the better you can keep your other eye-related issues in check and under control, the better off you'll be overall for your visual health, and that would include the AMD as well. So I would think about all you can do is regularly see your doc. You know, if you figure out what your triggers are, try and keep them down. See somebody right away. Keep those, treat the inflammation, treat the glaucoma, treat everything else. But there's no direct connection. But you know, if you've got one thing ticking in your retina, and you know that's bad enough. If you've got two, you know, they can compound on one another.
Thank you. I think in the interest of time, we'll close this conversation right here, but there's still the exhibitors outside, and we will be around. I really want to say that you've all been wonderful. Thank you for your insight, for your comments, for your questions. As Julie Maris mentioned, you are inspiring us to do more. So we really appreciate your attendance, and drive safely home.